The legalization of pot in our state means more people will be exposed to secondhand marijuana smoke.
But if your company, like most, has a zero tolerance policy, could that exposure cost you your job? And can you get high enough from secondhand smoke to get a DUI? Komo-Tv problem solver Matt Markovich wanted to find out the consequences you could face, even as a non-smoker.
You can't get drunk if the person next to you is drinking, but you can get high if they're smoking pot, and it could prove costly.
I was fired.
From a job Cheryl Hale had for 16 years.
I got hurt at work, and standard procedure when you get hurt, you get swabbed. No biggie.
Swabbed for drug use. To her surprise, she tested positive for marijuana, but she says she doesn't use pot.
Well, I'm arguing with the doctor, saying he's made a mistake. I said the only one that smokes marijuana is him.
Him is her husband, Edwin, a heavy pot smoker. And to make matters worse, they live in a 27-foot motorhome, lots of secondhand pot smoke.
I was fired for testing positive for marijuana, even though mine was from secondhand smoke.
So the problem solvers wanted to find out how easy it is to test positive from secondhand smoke. We did a little experiment.
So this is to test to make sure I have no THC in my body.
That's the chemical in pot. Would I test positive for pot just from the secondhand smoke from Edwin?
2 lines means I'm clean.
Coming back here.
We went to their tiny bedroom where Edwin would smoke while Cheryl slept and hung out. Cheryl Skype just sitting a few feet away behind a door. That's how the two communicate when Edwin now smokes.
That way I'm not near his smoke anymore. Leg and thigh?
Got some chicken.
You know, I got a little hungry.
Since marijuana is now legal in Washington, this could happen a lot. There's going to be a lot more people testing positive just from secondhand smoke.
She may be right. After an hour, I swabbed myself again using a drug test similar to the one used on Cheryl. The THC panel showed 1 line, no second line. That's a positive test for pot.
Now, if this was a random drug screening, I would have failed this particular test and been fired from my job, most likely.
But the problem solvers wanted to take the experiment one step further. Could I reach the level of a DUI from a secondhand high? We enlisted the help of a group of medical marijuana users to first create a setting as if I was at a party. Earlier, I used the swab test to show that I had no THC in my blood. I hung out for about an hour as they smoked some intense weed, rolled as joints and homemade vaporizers.
Yeah, I smoke all the time for medical purposes. I don't think I'm ever legal to drive.
We then stepped it up.
So what about a closed-in environment like the back of a car?
We piled into the back of a limousine and drove around, the air thick with pot smoke. But is it enough for me to reach the new DUI limit for pot in this state? Now here's a new term to remember, 5 nanograms per milliliter of THC. That's the active ingredient in marijuana. Meet that, it's an automatic DUI, even if it's from secondhand smoke.
Do you know what it feels like to have a 5 nanogram high?
No, I do not, and that's why I don't drive, of the uncertainty.
I'm very uncertain what 5 nanograms feels like.
And there's no studies that really show whether somebody would get over the 5 nanogram level in their blood from passive exposure.
Which doesn't bode well for my experiment, says Dr. Barry Logan, the former state toxicologist and nationally recognized expert in drug testing. He has a warning.
There's no way to equate a blood marijuana level to an equivalent level of impairment with the same level of confidence that there is with alcohol.
And that's what makes our state's 5 nanogram level for automatic DUI so controversial.
We know that a person is under the peak influence of alcohol when their blood alcohol levels are highest. It is the inverse for marijuana.
Logan says the THC levels can drop upwards to 60% 15 minutes after a person stops smoking, up to 80% after 30. But the new pot law requires a blood test for a 5 nanogram conviction, and typically the blood is drawn 2 hours after a traffic stop.
You're going to miss a lot of people who have elevated THC levels while they're driving.
After 2 hours of breathing secondhand pot smoke, I got out. Let's just say I was feeling no pain.
Oh, there you go. That's a potmobile. So it's been about a half hour since I left the limo, and yeah, I feel a little buzzed. We'll find out how much right now.
I went to a clinic and took a blood test. It showed an active THC level of 1.1 nanograms, below the 5 nanogram mandatory DUI limit. But accounting for the 1-hour delay in a blood draw, my nanogram level may have been 5.5 when I left the limo. If a blood test was taken then, I would have failed and gone to jail if I was driving. Logan says the 5 nanogram limit for a DUI should be lower.
I think it's too high for a per se level.
But the 5 nanogram limit isn't going to change soon.
So yeah, there are some holes in the law that they're going to hang around for a while, because we're not going to be amending the initiative for at least another couple of years.
Which means be careful of the company you keep and what they're smoking. Their high may be your downfall. Matt Markovich, Komo-4 News.
There is no breathalyzer test for THC levels in blood like there is for alcohol. Marijuana inhaled secondhand can stay in your system for up to 3 days. For heavy pot smokers, THC will stay in their blood for weeks. About 100,000 people in our state have medical marijuana authorizations, but nobody knows for sure because prescribers don't have to report how many they give out.
Tonight, medical professionals go on the record with Komo-4, saying marijuana authorization abuse is widespread. Komo-4 problem solver Matt Markovich went undercover to find out how easy it is to get a pot prescription for a price.
Pot, it's legal, but it's not. The laws are as murky as the smoke it creates.
In this awkward interim period where it's sort of, you can have it, but you can't get it. It's like the marijuana fairy gives it to you.
And for many, the marijuana fairy is this: a medical marijuana recommendation. With one, a state resident can go into a growing number of medical marijuana co-ops and buy pot. Not just 1 ounce, but 24 ounces, a pound and a half. State law says a medical marijuana recommendation is intended to help qualified patients from specific terminal or debilitating medical conditions, like cancer or chronic pain that cannot be treated by traditional methods. Well, we decided to go looking for the pot fairy. And to find out just how easy it is to get a medical marijuana recommendation. First, I went to a Tacoma clinic known for issuing cannabis recommendations with no appointment, saying the only issue I had was an occasional headache. In another room, I fully expected a regular doctor visit. Instead, it was a state-licensed advanced registered nurse practitioner Skyping in from Hawaii. My Skype visit lasted 3 minutes, and I walked away with a recommendation saying, I have diagnosed this patient, Markovich Matthew, as having a terminal or debilitating condition. Then I went to a similar South Seattle clinic. The same routine, packed waiting room. I only said that I had occasional stress headaches and wanted to try cannabis. In 10 minutes, I had my recommendation for $99, cash only.
Like it was a marijuana mill.
We just felt like it was a cattle call and it was all about money.
Dr. Corey Lynn, a naturopathic physician, and Cheryl Chavez, an advanced registered nurse practitioner, are putting their state licenses to practice medicine on the line by speaking out.
It was around 30 patients a day, and at one day I saw 43 patients in one day.
Both women used to work at South Sound Medicine in Lacey, one of many local clinics well known for issuing cannabis recommendations.
Out of the maybe 3,000 patients I saw in a year, one came in that wasn't a medical marijuana patient, and that felt incredibly wrong to me.
When you first started, your whole job was there to listen to people said and then write recommendations?
Yes, that was it.
To verify their claims, I went to South Sound Medicine. I did the same routine as the other clinics. I paid $200, and I walked out with a recommendation. So, 3 visits, 3 sets of recommendations. I was never denied.
It was money driven. How many patients can you see? You know, we didn't get breaks, or I didn't get breaks. It was just get them in, get them out, see how many we could have. I was working 6 days a week.
But there was also a financial incentive for Chavez and Lynn. The more patients they saw, the more they got paid.
The people want to be known as pot doctors, but it's lucrative to be a pot doctor.
It is, and you get a lot of appreciation from your patients too, I find.
Both Chavez and Lynn have left South Sound Medicine.
I became exhausted and I was terrified I was going to lose my license.
They're speaking out, they say, to expose clinics forcing physicians to abuse state law. The clinic's attorney denies South Sound Medicine is a marijuana mill.
Their focus is to provide services to clients. that's what their business is. And cannabis's recommendations is but one aspect of that company.
Physicians are not required to report to the state the number of medical marijuana recommendations they write. State health officials can discipline a licensed healthcare worker for not following the health rules, including the state's medical cannabis law, which can include the loss of their medical license. But those same authorities have no jurisdiction over the clinic, which is considered a business. Which brings us back to the state's murky marijuana laws.
It's like the marijuana ferry gives it to you. So.
But as we found, for a price, you don't need a ferry to get your pot. Matt Markovich, Komo-4 News.
For medical marijuana recommendation, clinics typically charge twice the cost of a normal office visit. Only a small handful of licensed healthcare workers have been disciplined for abusing the medical cannabis law since it was adopted in 1998. 100,000 people in our state have medical marijuana authorization cards, letting them grow marijuana or be part of a co-op that grows and sells it to them. But that's where the protections end.
Komo-4 problem solver Matt Markovich went undercover and found that people who rely on medical marijuana have no recourse if they get stuck with bad pot.
Everything about medical marijuana is based on trust.
I started smoking it when I became depressed, and it helped me tremendously.
Michael Vanditto has been a card-carrying medical marijuana smoker for years, but then he stopped.
I mean, I've never been so sick in my life. Total weakness, inflamed lungs, total disorientation. I could only get out of bed for an hour or two.
He suspected it was from fungus in marijuana he bought at the North Seattle Medical Collective.
I only became ill when I started shopping at this particular marijuana medical shop.
He says his doctor couldn't identify his illness, but his symptoms were akin to fungal pneumonia. For people with compromised immune systems, fungus in pot could lead to a deadly infection called aspergillosis.
Basically, the fungus takes up residence. Instead of on the plant, suddenly it's growing in your lungs.
Vanditto considered the medical pot he bought a health hazard and wanted it tested by authorities. But he quickly realized a predicament facing all medical marijuana users. There's no public agency he can turn to.
People think it's legal for all these other purposes, but it isn't.
Vanditto asked for help from the problem solvers. We wanted to test the marijuana the collective was selling. So we outfitted Vanditto with a hidden camera because he's authorized to buy medical marijuana. Only members are allowed in the collective's bud room. With more than 30 strains to choose from, Vanditto let the attendant choose a strain for him, Granddaddy Hayes. We then turned to the state agency charged with protecting residents from health hazards, the Department of Health. We wanted them to test the pot for fungus. They refused, issuing a statement saying, the Department of Health has no authority to inspect or check quality of marijuana. We then went to the State Liquor Control Board, the agency that will oversee the upcoming so-called legal recreational use and sale of marijuana. And that includes consumer safety.
We're supposed to set, quality standards, making sure consumer safety is involved in this.
But here's the irony. It cannot legally set up protections for medical marijuana users, sick people who may need it the most.
The state has no responsibility in the regulatory functions of medical marijuana. And Initiative 502 doesn't impact medical marijuana either.
It's sending the wrong message to people.
Doug Hyatt is an attorney representing users and growers of marijuana. He blames the mixed messages on conflicting and poorly written laws and believes the state won't ever get involved in pot testing because the federal government sees marijuana as illegal.
You're subjecting state employees to federal criminal law.
And this should catch almost everything that's growing.
So concerned users are leaving up to a growing industry of private laboratories like Analytical 360 in North Seattle to perform quality testing on pot.
There is an issue with things being tainted. So I'm crushing it up here.
Analytical 360 tested the pot for fungus immediately after Vanditto bought it.
You can't tell what it is by smelling it or tasting it. You have to actually have a chemical analysis done.
The lab says it exceeded the acceptable range of fungus for therapeutic marijuana. At this rate, smoking it could lead to fungal pneumonia, and sick people shouldn't be smoking it. We wanted another test. A month after the first buy, Vanditto went back to the dispensary buying some A-Train, another strain of marijuana the attendant suggested. Analytical 360 tested it. The fungus levels were lower than the first sample, but still above the acceptable range for therapeutic marijuana. We then told North Seattle Medical Collective of our hidden camera investigation.
We inspect all the products, and it seemed okay to us, and we smoked it, obviously, because we try everything.
The collective uses ultraviolet light to test the marijuana it gets from growers.
If there was anything that was moldy, it would show up green.
But after viewing Analytical 360's results online, its Granddaddy Haze and A-Train are
no longer available. The growers have been alerted, so that's not acceptable.
Dank says because of our investigation, they will now offer full microbial testing on all of its products.
Because we came in with our camera, that you're now going to do microbial testing instead of this?
Absolutely.
So it comes down to this. The business of medical marijuana is all about trust because the user has no legal protections from buying bad pot.
We operate on a certain level of trust with the patients that if there is something wrong or they're experiencing a negative side effect, they come and tell us.
Vanditto says he's not going to smoke marijuana anymore, or not until there's a quality control system in place that he trusts.
I don't want to take the chance of getting deathly ill again.
In Seattle, Matt Markovich, KOMO-4 News.
Analytical 360 posts the results of all its tests on its website for anyone to see, our test included. The lab believes the marijuana industry needs total transparency regarding all marijuana products on the market.